I'm Changiz, Geula, Professor of Neuroscience at Northwestern University Medical School in Chicago, and as co-convener of the 5th International Conference on Alzheimer's Disease and Related Disorders in the Middle East, I extend to you a very warm invitation to join us at this conference, which will be held on May 15th through 17th, 2009, in Limassol, Cyprus.
I am Marwan Sabbagh, Chief Medical Scientific Officer and Director of Clinical Research at Sun Health Research Institute in Sun City, Arizona. I would like to invite you also and welcome you to the 5th International Conference on Alzheimer's Disease and Related Disorders in the Middle East.
Why are we here? Why this conference? As you know, Alzheimer's disease and related disorders come at a significant and substantial costs, both individually and socially. We continue to make great gains in our understanding and treatment potentials of these disorders. Therefore, it is very important to stay abreast of new developments about these disorders and to discuss their implications.
This conference capitalizes on the momentum set forth by the 1st through 4th conferences under the same name. They have been successful in bringing scientists, physicians, other clinicians, and policymakers from all over the Middle East in a way that allows dialogue and scientific progress to be made.
While this conference is of particular significance to researchers and clinicians in the Middle East, the benefits go far beyond that. First, they allow for networking to take place between physicians and scientists in the Middle East and those of other countries. And second, the subject matter covered should be of benefit to clinicians and scientists worldwide. The aims of this conference are to focus attention on dementia and neurodegenerative disorders of the aged in the Middle East, to raise scientific, medical, and social awareness of these disorders,
to enhance communication amongst scientific workers and medical workers in the region, to foster and enhance collaboration between health workers and researchers in the Middle East with their counterparts in the U.S., Europe, and other parts of the world. This conference is intended to bring people from all over, including Turkey, Greece, Cyprus, Israel, and all Middle Eastern countries. They have been able to foster dialogue and communication in an unprecedented manner, and we would like to continue this in this conference. They have exchanged scientific ideas as well as discussion on care delivery systems from different countries.
The topics to be covered at this conference are varied, and they include molecular, anatomical, and chemical basis of the disease, the genetics of the disease.
They also include topics and conversations on diagnosis and clinical features, treatment of dementia, care, and public policy.
The poster sessions at this conference have been expanded, and we encourage those interested to submit posters, abstracts for the poster presentations, and this can be done on the conference website. Why attend this conference? As was the case with the past 4 installments of these conferences, the 2009 conference will be of interest to both basic scientists and clinicians. Nearly all basic science aspects of Alzheimer's disease and related disorders are on the agenda for this conference, including up-to-date information on pathogenesis of these disorders, the anatomical distribution of their pathology, neurochemical alterations, cell signaling changes, genetics, as well as targets for neurotherapeutics.
Clinical topics will include emerging diagnostic and current diagnostic targets strategies. Specifically, there will be a lot of comments about and presentations about biomarkers. Additionally, we'll talk about current treatment strategies and emerging therapeutics. This conference is for clinical physicians, not simply neurologists and psychiatrists, but all clinical physicians and clinical clinicians that are involved in the care of the dementia patient, including internal medicine physicians, family physicians, other primary care physicians.
The last 4 conferences attracted scientists from many disciplines. Similarly, the program of this 5th conference should be of interest to basic scientists of various specializations, from cell biology to systems function, from anatomy and pathology to molecular biology.
Also, we would like to include extenders of care, including policymakers, program developers, and other people who help in individual countries improve the care and delivery of care to patients with Alzheimer's and dementia.
It is important to emphasize that while held close to the Middle East, this conference is intended for scientists and clinicians interested in Alzheimer's disease and related disorders throughout the world, and therefore attendance is open to participants from all countries. In particular, we encourage young scientists and clinicians to attend, as this conference may be of special benefit to them. In closing, we would like to once again extend a special invitation to all interested scientists and clinicians to attend the 5th International Conference on Alzheimer's disease and related disorders in the Middle East, which will be held on May 15th through 17th, 2009 in Limassol, Cyprus.
The conference will be held at the Grand Resort in Limassol. For more information, registration, abstract submission, and sponsorship and display, please go to www.worldeventsforum.com/ALZ. We look forward to seeing you there and hope you will be joining us next year.